think beyond cardiovascular disease and diabetes and some infections, which used to be the big problem we used to talk about, cancer is the next big problem which all of us are facing. And I'm sure in this crowd, all of you will know either in your friend circle or among your family members, at least one person who's affected by some form of cancer and has undergone some treatment. Certainly, because the Indian data itself suggests that 1 in 10 people during their lifetime will get some kind of cancer. Clearly, the traditional treatment for cancer always used to be chemotherapy, which used to be very horrendous with all its side effects. And in today's world with newer innovations, people are looking at immunotherapy. That's what I will discuss over the next 5-10 minutes. Just give you manufacturing is a tedious process. Like I mentioned, I won't show you the details. This is just a cartoon picture of how cells are collected. We've had 2 of them who have actually undergone this. So you can ask them questions about what actually happens. But this is the gist of it. You collect cells, it's taken into the lab, they do some processing there, like what I mentioned, and then it's given back to the patient with a very mild chemo just before we put the cells back, which is very. We have not given any chemotherapy. We've just given a mild, small dose of chemo. Just before you infuse the cell, you just collected cells, given it back, and you can see some of that totally. This, as of now, only 2 people are manufacturing CAR T cells in the country. There are more coming up, certainly, because the need is much higher. For our population, we need, more than 20-30 companies to be actually manufacturing this. But because it's so difficult, like I showed you, that's the reason why I showed you that slide, that how difficult it is. That's why there's a very strict process of maintaining, rigid infection control and quality control so that the product, when it comes out, is something which is good enough to be reinfused back to the patient.
Prevalent line of treatment that is usually the patients like me will undergo rigorous chemotherapy cycles, and after that there will be some remission, maybe 3 months to 6 months. In my case, it is 6 months. It has relapsed, and then now to kill it again, they will give 1 more round of or 2 more round of chemotherapies, and post that also, the disease was not going away, so it was haunting me. So and then I was like hitting the dead end and nowhere to go, and the only option left out is to enroll myself for the BMT, because till that time I was also not aware about CAR T cell therapy. Then I went to one of my close family doctor. Then he said that you have hit a dead end. Now the only left out is you have to go to the best in Bangalore. So I think you will waste it not even a single day. The same day, morning I met my family doctor, and at noon I took Dr. Sharasat appointment.
Exactly what happens even in the bone marrow transplant setting, There also the cost, which is about 1 crore in the US, is now clearly done in the 15-20 lakh range in most places in the country, or sometimes even between 10 to 15 lakhs, which is a month in the hospital, by the way. It's not like it's one day you stayed for 3 days and went home. All these treatments are situations where you're keeping patient in the hospital because they're immunosuppressed, there's an infection risk, they will be monitored, the sterile environment, all of that, So that's where the actually cost comes in. So you will be able to drop it up to a point, but I'm thinking somewhere in that 10 to 15 it might plateau.
Just one
thing. 2018 she got diagnosed with lymphoma, and we went 6 cycles of chemo in Coimbatore, and again she got relapsed in 2020, and again we went for some 6 cycles in Coimbatore. During November 2022, one of our cousin was a doctor in Karur, and she came to know about this, and they recommended to meet Sarath sir, this thing, and we go through this. So finally she survived almost 3 years now. After 10-15 days, they used to have a food and something like that. Some liquid diet is going down. And after this CAR T of 30 days, we seen a recovery in 10 days, and he started moving around and having our regular things. Yeah.
அம்மா இந்த சிகிச்சைக்கு பிறகு உங்களுக்கு
I don't know if it's appropriate. So one of the PSUs that we work with very closely in terms of large funding that we get is Coal India. Coal India, along with the central government, gives us a lot of funding for advanced therapies. So that's one example I can give you. There are state governments as well. The Karnataka state government also covers certain treatments. CAR T is yet to be incorporated, but then bone marrow transplants, which is one of the most expensive treatments for patients. those are also covered by certain state governments. So we have several corporate houses, which I would not like to call out in this forum, but then we do have corporate houses who are willing to fund treatment for patients.
What about insurance companies?
So it's a little. So insurance companies traditionally have stayed away from what they call novel therapies. It's only recently that insurance companies are coming forward and covering novel therapy. So even a robotic surgery is considered a novel therapy, and we have been working with insurance companies to get them to cover a lot of these therapies.
ಯಾಕೆ ಚರ್ಚೆಗಿದೆ ಅಂದ್ರೆ ಈಗ ಕ್ಯಾನ್ಸರ್ ಕಾಯಿಲೆಗೆ ಜನರಲ್ ಅಥವಾ ಸರ್ಜರಿ ತಿಳುವಳಿಕೆ ಇರುತ್ತೆ. ಇತ್ತೀಚೆಗೆ ಇಮ್ಯುನೋಥೆರಪಿ ಅಂತ ಒಂದು ಹೊಸ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಂದಿರೋದ್ರಿಂದ ಅದು ನಮ್ಗೆ ಜನರಿಗೆ ಅದ್ರ ಬಗ್ಗೆ ಅವೇರ್ನೆಸ್ ಕೊಡ್ಲಿಕ್ಕೆ ಈ ತರ ಮೀಟಿಂಗ್ ಕರ್ಸಿರೋದು. ಈಗ ಈ ಎರಡು ಪೇಷಂಟ್ಗೂ ಈ ತರ ಈ CAR-T ಥೆರಪಿ ಅಂದ್ರೆ ಇಮ್ಯುನೋಥೆರಪಿ ಅವ್ರದೇ ಸ್ವಂತ T ಸೆಲ್ಸ್ ಕಲೆಕ್ಟ್ ಮಾಡಿ ಅದನ್ನ ರಿಸೆಪ್ಟರ್ ಚೇಂಜ್ ಮಾಡಿ ವಾಪಸ್ ಹಾಕಿದ್ರೆ ಆ ಸೆಲ್ ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ಸ್ ಹೋಗಿ ನಾಶ ಮಾಡುತ್ತೆ. ಇದರಲ್ಲಿ ಸ್ಟ್ರಾಂಗ್ ಕೀಮೋಥೆರಪಿ ಅಥವಾ ಸರ್ಜರಿ ಕೂಡ ಅವಶ್ಯಕತೆ ಇರಲ್ಲ. ಅಂಡ್ ನೀವೇ ನೋಡಿದಿರ ಇವಾಗ ಈ ಪೇಷಂಟ್ಸ್ ಗೆ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆತರ ಏನಿಲ್ಲ, ಬಹಳ ಸುಲಭವಾಗಿ ಮಾಡ್ಬೋದು. ಸ್ವಲ್ಪ ವಯಸ್ಸಾಗಿದ್ದು ಪೇಷಂಟ್ಸ್ ಮಾಡ್ಬೋದು. ಈಗ ಸದ್ಯಕ್ಕೆ ಕಾಯಿಲೆ ರಿಟರ್ನ್ ಬಂದಾಗ ಮಾಡ್ತಾ ಇದ್ದಾನೆ, ಇವಾಗ ಉಪಯೋಗಿಸ್ತಾ ಇರೋದು. ಸದ್ಯಕ್ಕೆ ಇನ್ನು ಮುಂದೆ ಕಾಯಿಲೆ ಕಂಡಿದ್ದ ಕೂಡಲೇ ಅದನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಅವಶ್ಯಕತೆ ಸಿಗತ್ತೆ. ಥ್ಯಾಂಕ್ ಯು. ಸೊ ಇವಾಗ ಆಕ್ಚುಲಿ ಪೇಷಂಟ್ ಮುಖಾಂತರ ಆಲ್ಮೋಸ್ಟ್ 20ಕ್ಕಿಂತ ಜಾಸ್ತಿ ಪೇಷಂಟ್ಸ್ ಆಗಿದೆ. ಇದರಲ್ಲಿ ಲಾಂಗೆಸ್ಟ್ ಫಾಲೋ ಅಪ್ ಇರೋ ಪೇಷಂಟ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ ಇವಾಗ 3 ವರ್ಷ ಆಗಿದೆ ಇವಾಗ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಾದ್ಮೇಲೆ ಅವರಿಗೆ ಇವಾಗ ಫಾಲೋ ಅಪ್ ಕರ್ಸಿದ್ವಿ. ಬಿಕಾಸ್ ಕ್ಯಾನ್ಸರ್ ಕಾಯಿಲೆದಲ್ಲಿ ಎಷ್ಟು ನಮ್ಗೆ ಜಾಸ್ತಿ ಫಾಲೋ ಅಪ್ ಸಿಗುತ್ತೆ ಅಷ್ಟು ಒಳ್ಳೆ ಕ್ಯೂರ್ ರೇಟ್ ಇದೆ. ಜನರಲಿ 5 ವರ್ಷ ಕ್ರಾಸ್ ಆದ್ಮೇಲೆ ನಾವು ಕಂಪ್ಲೀಟ್ ಕ್ಯೂರ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಲಿಂಫೋಮಾ ಕಾಯಿಲೆದಲ್ಲಿ ಜನರಲಿ ಕಂಟಿನ್ಯೂಸ್ ಜ್ವರ 2 ವಾರಕ್ಕಿಂತ ಜಾಸ್ತಿ, ವೇಟ್ ಕಡಿಮೆ ಆಗೋದು, ಕೆಲವು ಜನರಿಗೆ ಗಡ್ಡೆ ಬೆಳೆದಿದ್ದು ಕೈಗೆ ಸಿಗೋದು, ಆ ತರ ಎಲ್ಲ ಸಿಂಪ್ಟಮ್ಸ್ ಬಂದ್ರೆ ಅದು ಲಿಂಫೋಮಾ ಅಂತ ಹೇಳ್ತೀವಿ. ಬಿಕಾಸ್ ಇದು ಲಿಂಫ್ ನೋಡ್ ಅಥವಾ ಲಿಂಫ್ ಗಡ್ಡೆದು ಕ್ಯಾನ್ಸರ್ ಕಾಯಿಲೆಗೆ ನಾವು ಲಿಂಫೋಮಾ ಅಂತ ಹೇಳುದು. ಅದಕ್ಕೆ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಬರೀ ಕೀಮೋಥೆರಪಿ ಇರ್ತಿತ್ತು. ಬಟ್ ಇತ್ತೀಚೆಗೆ ಈ ತರ ಟ್ರೀಟ್ಮೆಂಟ್ ಇರೋದ್ರಿಂದ ಇಮ್ಯುನೋಥೆರಪಿಯಿಂದ ಅದರಲ್ಲಿ ಜಾಸ್ತಿ ಗುಣಪಡಿಸೋ ಚಾನ್ಸ್ ಇದೆ.
ರೂಟ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಕ್ಯೂರ್ ಆಗುತ್ತೆ.
ಅದೇ ನಾನು ಹೇಳ್ತಿರೋದು, ಕಂಪ್ಲೀಟ್ ಕ್ಯೂರ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇದೆ. ಸೊ ಪ್ರಿಕಾಷನ್ಸ್ ಇದು ಬರಬಾರ್ದಂತ ನೋಡ್ಲಿಕ್ಕೆ ಜನರಲ್ ನಾವೆಲ್ಲ ಹೇಳ್ತೀವಿ ಹೆಲ್ತಿ ಲೈಫ್ ಸ್ಟೈಲ್, ನೀವು ಏನೆಲ್ಲ ಏನೋ ಆಹಾರ ತಗೊಳ್ಳೋದು ಸ್ವಲ್ಪ ಜಾಗೃತಿ ಇರಬೇಕು, ನೋ ಸ್ಮೋಕಿಂಗ್, ನೋ ಆಲ್ಕೋಹಾಲ್, ಸೆಡೆಂಟರಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಇರಬಾರ್ದು, ಆದಷ್ಟು ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡಬೇಕು, BP ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಇದ್ರೆ ಅದೆಲ್ಲ ಮಾಡಿದ್ರೆ ನಾವು ಜನರಲ್ ನಮ್ದು ಹೆಲ್ತ್ ಚೆನ್ನಾಗಿರುತ್ತೆ, ಕ್ಯಾನ್ಸರ್ ಬರೋ ಚಾನ್ಸಸ್ ಕಡಿಮೆ ಇರುತ್ತೆ. ಬಟ್ ಸ್ಪೆಸಿಫಿಕ್ ಆಗಿ ಇವಾಗ ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಸ್ಮೋಕಿಂಗ್ ಮಾಡದೆ ಇಲ್ಲಿದ್ರೆ ಬರೋ ಚಾನ್ಸಸ್ ಕಡಿಮೆ ಅಂತ ಹೇಳ್ತೀವಿ. ಆ ತರ ಇದ್ಯಾವುದು ಕಂಡಿಡ್ದಿಲ್ಲ ಈ ತರ ಕಾಯಿಲೆಗೆ. ಸೊ ಇದು ಇತ್ತೀಚೆಗೆ ಇವಾಗ ನಾನು ಹೇಳಿದ್ದಲ್ಲ ಒಂದು 25-30 lakhs ರೇಂಜ್ ಅಲ್ಲಿ ಇದೆ. ಬಟ್ ಡೆಫಿನೆಟ್ಲಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಅಂಡ್ ಐ ಆಮ್ ಥಿಂಕಿಂಗ್ ಸೂನ್ 10-15 ಲಕ್ಷ ರೇಂಜ್ ಅಲ್ಲಿ ಬರಬಹುದು ಅಂತ ಅನ್ಸ್ತಾ ಇದೆ. ಬಿಕಾಸ್ ಈ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರಿಂಗ್ ಎಲ್ಲ ನಮ್ ದೇಶದಲ್ಲೇ ಆಗ್ತಾ ಇದೆ ಈಗ. ಸೊ ಈಗ ಸದ್ಯಕ್ಕೆ ಮೇನ್ ಹಾಸ್ಪಿಟಲ್ ಇವಾಗ ಎಲೆಕ್ಟ್ರಾನಿಕ್ ಸಿಟಿನಲ್ಲಿ ಇರೋದು. ಬಟ್ ಟೋಟಲಿ ಇಂಡಿಯಾದಲ್ಲಿ ಒಂದು 34 ಹಾಸ್ಪಿಟಲ್ಸ್ ಇದೆ ಈಗ ಸದ್ಯಕ್ಕೆ ಎಲ್ಲ ಅಕ್ರಾಸ್ ದ ಕಂಟ್ರಿ. ಶರದ್ ದಾಮೋದರ್. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.